Hello friends, I hope you are doing very well in your daily life. In this video, I am going to give you a brief introduction about the most commonly used blood collecting tubes and the blood test. The one most important thing that you should keep in mind while watching this video is that I'm just giving you a general introduction or general information, but don't forget to read the manufacturer instruction given on the vial for the specific tube, and that gives you a proper guideline about that given tube. So let's start with this purple color or lavender color top blood collecting tube that contains K2-EDTA in it as an anticoagulant. So this tube is used for the whole blood hematology testing. This would give us information about the CBC. We can find out the white blood cell count that increases in most of the infection cases. We can also determine the platelet number that if deplete then may lead to some bleeding disorders. And the one most important thing while using this top blood collecting tube is that ensure the proper mixing of this agent with your blood sample, and for that purpose you have to invert the tube 4 to 5 times in this way after collecting the blood in this tube. Let's move to the second one, that is yellow colored or gold colored top blood collecting tube that contains a clot activator or the serum separator. This would separate the serum from your blood, and this tube is used for the serum biochemistry analysis. This would give us information about the sodium, potassium, urea, creatinine levels, and we can find out the RFTs, LFTs while using the serum that is separated in this tube. This would also give us information about the bone profiles, C-reactive proteins. The one most important thing is that this tube can also be used for the endocrinology, oncology, virology, and toxicology and immunology assessments of the blood sample. Most of the lab technicians mention that keep the vial in a standing position for about 5 to 7 minutes for the proper clotting of the blood. But literature says that the tube should allow the inversion for 2 to 3 times for the proper mixing of this agent with your blood so that the blood clot properly. Next one is the gray color top blood collecting tube that contains the sodium fluoride and the potassium oxalate. In this tube, the potassium oxalate is an anticoagulant that gives a plasma sample, and the sodium fluoride is an anti-glycolytic agent. So the gray top colored blood collecting tube is used for the two most important biochemistry tests. Number one is the blood glucose levels that may be fasting or random, and for the assessment of lactate that may increase in any case of hypoperfusion such as sepsis or acute ischemia. So this top should also be this color. Ensure the proper mixing of the additive with the blood in this case as well. So the next one is blue color top blood collecting tube that contains the buffer sodium citrate. The blue color top collecting tube is used for the hematology testing to assess the clotting systems. The clotting coagulation screen test includes the prothrombin time, activated partial thromboplastin time, and fibrinogen. So this was all about the uses of these all blood collecting tubes. This video was just to improve your knowledge about the use of the equipments or blood collecting tubes, but the hospital staff is always there to help you, so don't afraid to ask them for the guideline or for any advice. Thank you.